Welcome to the Vintage Times, a program for senior citizens. On our program today, we will talk about senior care issues. We will discuss common situations faced by older people and their families when the time comes to make changes in the senior's lifestyle due to poor health or frailty. To make changes in a senior's lifestyle is overwhelming and stressful, both financially and emotionally. It is very important to know where to seek help and what questions to ask. With me today is a person who has much experience in helping older people and their families deal with these problems. With me is Mardi Chizak. She is the owner of Charism Elder Care Services.
Correct.
And thank you, Mardi, for joining us and returning. You've been with us before. And can you please tell us how you came to choose the word charism for your company?
In the role of Charism Elder Care Services, I am a elder care navigator.
Okay.
And in that role, I decided that the name would be Charism. I found that word at church. I was looking in the church bulletin right before Easter, and the word charism, there's the oil of charism, and I looked at what the name meant. And the word, it's a Greek word that means power, enabling, gift. And it just really touched on what I think I'm able to provide for seniors that I work with.
So what you provide mainly is a gift. It's empowering older people. Is that how you would describe it?
It is, and it's really a two-way relationship. It's the gift of giving empowerment, independence, autonomy to the senior who's aging and struggling.
Wonderful.
And it's also a gift to me because I get to hopefully improve someone's life and make this part of the journey less stressful.
That's wonderful. Remember the name Charism. That's wonderful. So, Mardi, what are some issues that you face when you deal with older people and their families when they need to change a lifestyle?
I think the most frustrating part for me as a provider is we, as human beings, tend not to face issues that are tough issues. So we kind of procrastinate on things that are really the tough things. And so often what happens is when I get that call to come help someone, the family or the senior has seen changes in one's life, in one's memory, and one's safety for perhaps months, if not years, and wait until something happens. There's a fall with a fracture or a hospitalization. Part of that is denial, but part of that is just, it's really hard. It's very, very difficult to make the changes that we're asking people to make in the dynamics of their family and their life. Tough stuff.
So people put things off because it's difficult to deal with the change. Is that it?
I think part of it is difficult to deal with the change, but the other part of it is not knowing where to even go for help.
Okay.
Just a powerlessness of, oh my gosh, it seems overwhelming to me. There are so many factors to this. I don't even know which one to pull out and deal with first, so I don't deal with anything.
So they call you, and when you come, what do you do?
The first thing I do, or my primary role in working with seniors and their families, is safety.
Okay.
I can't make you 20 years old again. I can't take away the diseases you have. I can't take care of the losses you have, but I can make this part of the journey, the next steps of the journey, safe for you. And that safety includes physical safety, so looking at your home. Is it safe for you to live there? Looking at your medications, because we know Medications, you know, seniors may not be on 1 or 2, they may be on 8 or 9 or 10 medications, and are there cross reactions? Looking at psychosocial issues. Maybe it's a dementia issue and you don't even realize you're not safe. So there are many factors to that safety that I look at when I come into an environment, and I go to the seniors environment because that's where you live and that's where you're comfortable.
Right.
And to have you come to my office or to come to a doctor's office is artificial.
Right.
It doesn't allow me to see how things function for you in your environment. So safety is really what I bring to the table, and looking at all the factors. It may be issues with finances, it may be issues with doctors you're dealing with, it may be issues with family, it may be issues with neighbors, you know, many facets to this safety.
So safety really is more than physical safety. Can you describe some medications, for instance, can lead to problems with safety? What do you recommend?
Well, from a medication standpoint, many of the medications have effects on your blood pressure, on your heart, sometimes on your brain, and all of these things are interrelated. And so what we want to do is look at the medications. Our society is very physician specialty based. So you go to the heart doctor, and you go to the kidney doctor, and you go to the lung doctor, and you go to the cancer doctor, and it's very fragmented. And each doctor does not necessarily speak to the other doctor. So one doctor may be giving you medication that's really impacting on the side effects of the other medication you give. So it's important to really look at all the medicine. Like many high blood pressure medicines, when you stand up, you'll get lightheaded and dizzy. Well, there are some things we can do about that. Some of the water pills will eliminate electrolytes from your body and make you weak, make you likely to fall. And the list goes on and on and on. So the first thing we do is look at the medication, the medicines you're on. You may have been on a medication for 20 years, you may not need it anymore. And so we need to ask those questions.
Right.
You are not the same person you were 20 years ago. So we need to look at the big picture and see what's going on. I don't suggest stopping your medicine. That's not the message by any means, but really looking at what do you have, and then I can have a communication with that physician or those physicians and talk about your global needs as opposed to the specialty needs.
Very nice. We should mention that Marty is a nurse in addition to many other specialties that you have. So medications is very important. You will review them with me. You will help me talk to the doctor, the pharmacist, or family members to be sure that I take them properly.
Absolutely. One of the things that I've had a number of patients fall is you're on a water pill either for kidney disease or for your blood pressure, and you take it in the evening rather than the morning.
Right.
So you're up all night going to the bathroom. And again, just the timing of doses and making that medication that you take as simple as possible, because it doesn't matter how old you are. If you have to take a pill 4 times a day, it's unlikely you're going to remember all 4. So if I can give it to you 1 a day or 2 a day, it's much more likely that you're going to take that medication that is essential for maintaining your independence and your autonomy.
Wonderful. That's so important. Now, you mentioned fragmentation of healthcare. What do I need to do and know to have a good relationship with my doctor?
Well, first off, you need to find a good family practice internal medicine doctor that is comfortable working with seniors. Seniors' needs are different than the needs of someone in their 20s or 30s. So a physician or a nurse practitioner, which I am, that really understands the needs of a senior and the medication effects. We don't really even know, because all the drug testing that's done on medication to get it to the market is done on young, healthy males. And so we don't even know how medications work in seniors. So some of this is kind of testing.
Right.
So finding someone who is your advocate as a healthcare provider that will really look at the profile. It can be a geriatrics physician, it need not be, but someone who really understands the needs of a senior and is willing to advocate and help you down this clinical path and this journey with you.
So you will go with me if I have to go to the doctor, you'll go with me. You'll advocate on my behalf.
Absolutely.
Yeah.
And so I will talk to that physician about, you know, did you realize that these are the other medications that Hannah's taking? These are the some of the side effects. Can we negotiate and perhaps talk about some other regimens? Can you tell me why Hannah's on this medication? Because based on what I know about her, I don't understand. And certainly I'm not a physician, but it's important to ask those questions. And before we go to the doctor, you and I will be talking about what are your questions.
That's good.
Because that's important that the healthcare provider be held to a standard of helping you.
Now, if I go alone to a doctor, do you have some advice on how I can make him listen to me?
Well, I don't have any advice on how you can make anybody do anything, but the first thing you can do is make a list of your questions. Okay? There are no stupid questions. Okay? There are no stupid questions. Okay? And it's okay if you ask a question and you didn't get the answer that you wanted or you understood to ask again. Okay? Ask the physician or the practitioner you're working with to speak in terminology you understand.
Good.
Don't use big words and medical terminology.
Right.
Just because you don't understand medical terminology does not mean you're stupid.
Right.
That simply means that's a different language.
Right.
And you don't know that language. So it is perfectly okay to ask those questions. In fact, I will often make a second appointment because perhaps the senior goes in for one complaint but really has a lot of general questions. We actually make a follow-up appointment just to talk to the doctor.
Right.
Okay? We're making an appointment in 2 weeks and we want to sit down and speak to the physician.
Okay.
I want to understand how all of this works.
Yeah. And you tell the doctor it's important for me that you answer my questions. It's my health. Please answer my questions. Yeah.
Well, and it's you know, it happens at all ages. My sister is a breast cancer survivor and doing very well, but she had some kidney function changes. And she went to the doctor, and the doctor patted her hand and told her, "You just don't worry about it. That's my job."
Oh.
And my sister's response was, "No, it's my body, it's my kidneys, and I want to know what's going on." So don't be afraid to push back.
Right.
Do not be afraid to push back. In fact, I have one lady I work with that the doctor told her she's his most difficult patient. And she said, "Why?" And he said, "Because you asked so many questions." And I held out my hand and I said, "Congratulations, that means you're doing a great job."
Right, right. So prepare questions and be sure you understand the answers and ask again. Now, you mentioned something before about family dynamics, that you have to deal with family members and the senior, and it's not always smooth.
No, often it's not smooth. Family dynamics, you know, we're in a very mobile society. So you have 4 children and they're one north, south, east, and west.
Right.
And they all love you and care about you and want the best for you. However, they can't be here.
Right.
And it's very difficult because each of us have our own perspective on our life and the experiences we've had. Often the children want 4 different things done. And do not give the senior the authority and the respect and the dignity to make their own decisions. When my mom made the decision to go on hospice, and I was her power of attorney decision maker, but she was fine making her own decision. Her physician called me and asked me why was I not trying to convince her to take chemotherapy. Because it's her life.
Right.
It's her choice. And if Mom was confused and incapable of making that decision, then certainly I would have felt it an honor to participate. But as long as she's able to make her decisions, she needs to make her own decisions as long as they're safe.
Right. Safe. And you allow them the dignity to make their own decisions. As long as they know what the choices are, and it's their lives.
Right.
That's very nice. Now, when you talk about hospice and all that, is it important to have what is called advanced directives?
Oh, that's one of the most important things. An advance directive is a document, has to be written document, that tells the healthcare provider and your family how you want your life to live when you are no longer able to make your own decisions. So as long as I am up and ambulatory and able to speak and alert and oriented and able to make my own decisions,
that's good.
That advance directive document sits on the back burner. But at the point that I have a stroke, or I've had a major heart attack, or I've got a full body infection where I'm not able to make decisions on my behalf, then that person, your agent it's called, is designated to make decisions for you. It's important that whoever that agent is feels as you do.
Oh, yes.
So if, in my case, my sister is my agent for health care, my brother is my agent for my property and my finances. And the reason I selected that is my choice is I do not want to be resuscitated, I don't want a feeding tube, I don't want to be on a ventilator to artificially breathe for me. My brother would not be able to do that. He does not have the moral courage to do that.
It's a big decision.
My sister does.
Yeah.
My sister understands that I have lived my life as an independent human being in charge of my destiny, as much as I can be in charge of my destiny, and I want that destiny at the end of my journey to be consistent with how I've lived my life. And she is able to do that for me. Not that it will be easy,
no,
but she is able to do that for me.
Right.
And now is the time when you're healthy, when you're alert, when you're able to have that conversation. Please have it now. If you take nothing from Hannah and my discussion today, please do that. And it's very difficult. It's very difficult to sit down and talk with the people that you love and say, when I get really sick, this is what I want. But please do that. And people like me can help you with that.
Yes.
Help sort of be a mediator and a leader and a consultant in that discussion.
Right.
But it's so important because those of us that are in healthcare, we have to do everything unless you tell us otherwise. So if you don't want all the tubes and the machines, you have to write it down and tell me you don't want that.
Very
and
good.
You can actually get those documents off the internet if you go to the Illinois Department of Public Health. There are documents there that can stimulate that discussion.
We have these documents in the township office. They're called, one is called the Living Will, the other one is called Power of Attorney for Health Care. There's also one Power of Attorney for property. So be sure to complete them, because if you don't, you do not know that your wishes will be honored. So this helps.
Absolutely, and that's part of the whole process. You know, I look at the aging process as a journey. Our whole life is a journey, and we grow up and we are toilet trained, and we go to high school, and we go to college, and we get married, and this is just another step in the journey. And so the job of Charism is to keep that senior at a place that maintains the autonomy, dignity, and functionality that they have had. Certainly realizing, and the term that's used in the industry is aging in place.
Right.
And we age, we get a day older every day as we live wherever we live. I just worked with a bunch of college students, and they were talking about retirement homes. And I said, well, I'm not quite sure what a retirement home is, because at the age I am considered a senior, so I guess my house is actually a retirement home, right?
That's one way to look at it. That's true.
So it's keeping you as independent as we can, looking at all the facets of your life, your medical, your safety, your psychosocial, your memory, your function, your support network, and pulling in all those pieces that we need to improve, and supporting the things that are already in place to augment the others.
It's wonderful. It's very comforting to have a person like you come in at a time when I feel, and my family feels, that a change is necessary, but we don't quite know how to make a change, what is necessary. To have someone come in and take charge and help us make decisions. Now, you mentioned the term before, aging in place. I know you like to help people remain at home. Is there a time when it's better for people to leave their home?
Each situation is unique and individual. And so the timing is going to be different for different people. It may be a financial decision that is stimulating where the senior is able to live. It may be an issue relative to memory and dementia. It may be a purely medical decision where you're no longer able to walk and you're having shortness of breath and you need issues. So each situation is unique. And that's what, at least from my perspective, that's what I find exciting about working in this environment, is trying to identify those issues and find solutions for them to keep the senior at home. So when I meet with the family and the senior for the first time, we don't just talk about your medication. We talk about all the aspects of your life and how all of those are interacting and trying to identify what's going on. Now, certainly, you know, one of the challenges is, we talked about the denial. You know, I know I can do this. I've fallen 3 or 4 times before and it wasn't a problem. Well, this time you had a stroke with the fall, or this time you hit your head and had some intracranial bleeding with it, or, you know, nothing stays the same.
No.
Our bodies change, our functionality changes. I have way more wrinkles today than I had when I was 20 because my body is changing.
Right.
And so it's looking at the whole situation and identifying what we can do. No, it's never easy to leave your home, but sometimes that's the only safe option.
Right, and you will help me. I also want to mention that next month we will have a specific program on housing, where sometimes people prefer to stay at home. Sometimes there are nice options for leaving the home. So tune in next week. You mentioned before also that family members live far away. What is your role when you come in? You become like a family member.
I do. In fact, I've had several of my patients and their families say I'm actually the nurse daughter that they don't have.
Okay.
So you know, I can communicate with the family members that live out of state. I can be that continuity piece, that information piece, that safety piece. And my family lives out of state, so I have experienced some of that guilt, frustration, fear of being in another place where my parents are aging and I'm getting calls from the emergency room, or I'm getting calls from my siblings who live nearer them. It's a very powerless, it's a very powerless situation to be in. And hopefully if we look at charism and the gift and the empowerment, that's what I'm able to do, is empower that family to, even though a geographic distance, be a participant in their loved one's care and well-being.
That's so very, very comforting. It's like having another family member right there who comes as often as necessary, takes care of me, makes suggestions, communicates with all the family members, and just makes me feel very comfortable. It is a gift. It's a great gift. Thank you, Marty. Is there anything else of importance you'd like to add?
I think the main thing that I'd like the audience to walk away with is, don't wait. Please, you know that things are changing. Ask for help. If I'm early in the situation working with you, we have a better chance of maintaining than once we have had a crisis. Right. We can't necessarily go back. So as hard as it is to say, I need help, things are changing, please don't wait.
Right. Thank you, Marty. It was very, very helpful. And thank you for watching today. We hope that you've learned that it's not always easy as we get older to make changes in lifestyle, but it's a necessary part of the journey, as Marty said, and help is available. It's very comforting to have a professional person come and help us along in that journey. So please don't wait. Call us at the Township at 630-719-6682, or you can call Marty directly at 630-515-9223. And thank you again for joining us today.